Services training for educational diagnosticians and ARD facilitators. In this training, we will cover how your role as a diagnostician or ARD facilitator relates to the SHARS program, cover all requirements of documentation and IEPs, and review the relevant information for each SHARS service area. The acronym SHARS stands for School Health and Related Services. SHARS is a Medicaid program that allows school districts to receive federal reimbursement for certain health-related services as they are provided to students. There are 4 main requirements that a student must meet in order to be eligible for the SHARS program. The student must be under 21 years of age, enrolled in special education within your district, Medicaid eligible, and services must be documented in the student's IEP. When it comes to the SHARS program, educational diagnosticians should consider the questions who, what, where, when, why, and how. Who are the students that require service? What services do those students need? Where will those services be delivered? Like, for example, in the classroom or in the cafeteria. When will these services be delivered? Why are these services needed? Is it because of the student's disability or chronic condition? And how often will these services be delivered? For example, will it be 3 times a week for 30 minutes each session, 5 times a day, or possibly just as needed? Diagnosticians and ARD facilitators should always ask themselves, have you considered everything needed for the student to receive an equal and appropriate education? Another requirement for SHARS is that students submitted for Medicaid reimbursement must have a signed parental consent on file in order to qualify for Medicaid reimbursement. Parental consent plays a large factor in school districts being permitted to file SHARS claims for reimbursement. As of March 18, 2013, IDEA-B required districts to have a one-time signed consent be on file with the district. Parental consent should only be obtained for Medicaid-eligible students. If you are not sure if a student qualifies for Medicaid, please contact TSBS and we can check that information for you. Lastly, if a parent declines consent, it must be done in writing and provided to the school district. This also applies if a parent wishes to withdraw a previously approved consent. The parental consent document can be printed from your ARD software system. In support of the SHARS program, one of the areas of importance for educational diagnosticians and ARD facilitators like yourselves is what is known as informed consent. Informed consent refers to a parent or legal guardian's agreement allowing a school district to provide health-related services to a student while also billing Medicaid for those services. 3 areas of note that play a part in informed consent are the annual written notification, telehealth services, and third-party liability. To learn more about the 3 areas, please watch our SHARS General Information training video. As diagnosticians, it is important to remember that these areas do not require signatures from parents or guardians. Therefore, it is necessary to have procedures in place that confirm that this information was supplied to parents. Should your district ever undergo an audit, you may be required to prove this. This can be something as simple as an email confirmation that an annual written notification was sent to a parent, or that you have a tracking spreadsheet that shows all parents and if they were notified. Educational diagnosticians and ARD facilitators are the first line of defense in ensuring your school district is 100% compliant with the SHARS program. That means having fully complete documentation and adherence to retention guidelines. These guidelines include that all educational and Medicaid records are retained for at least 7 years. The maximum amount of time an audit can go back. That records are stored in a secure location and format while still being accessible. And that the LEA maintains written procedures regarding minimum documentation requirements and where documents are stored. Should your school district come under audit, you will have 10 business days to provide requested documentation. SHARS records must be maintained until all audit questions, appeal hearings, investigations, or court cases are resolved. Here is a suggested checklist of documents that should be collected and maintained for SHARS documentation. Be aware that this is not an all-inclusive list. Signed consent to Medicaid by parent or guardian. ARD, IEP documents, which should have examples of SHARS services, as well as the student's medical necessity for said services. Attendance records. Assessments and/or evaluations. Current provider qualifications, such as current licenses or certifications. Written agreements or contracts for contracted service providers. Required prescriptions or referrals for services. Medical necessity documentation, such as diagnoses and history of chronic condition or disability. Supervision logs. Session notes or service logs, including provider signatures. Transportation documentation, which includes daily trip logs, maintenance records, bus documentation, and documentation for cost reports like purchases, repairs, and expenses for fuel and oil. Claim submittal and payment histories such as remittance and status reports or general ledgers, and copies of signed and notarized certification of funds letters and supporting documentation, including quarterly COF reports. In addition to the previously mentioned items, the SHARS cost report and all supporting documentation should be collected and maintained for SHARS records. When it comes to the ARD IEP documents, session notes, service logs, and evaluations, the child's name and Medicaid number should appear on every page. Should your district come under audit, it is important to remember that auditors are not educators. They may not know everything that goes into the practical application of SHARS. Because of this, documentation needs to be clear and concise. Auditors tend to be overcautious when it comes to documentation. If they have a doubt about anything, they will likely disallow it, believing the district can always fall back to an appeal. This is why your documentation should leave nothing to chance. Now, let's discuss some recommended approaches when it comes to your students' IEPs. IEPs should have clear information that is straightforward, easy to understand, and not difficult to locate. Good documentation is key, not just because it will ensure that parents or guardians can have a clear expectation of what services are being delivered to their children, but also because large amounts of teachers, paras, and therapists do not necessarily know this information completely. During the creation of an IEP, it is important to remember that SHARS should never drive services. Trying to obtain more reimbursements is not suitable. The focus should always be on the needs of the student. This is why we advise diagnosticians to refrain from using a one-size-fits-all approach and instead concentrate on using a student-centered approach. Accurate information and appropriate decisions are always easier to support. An example of this could be a student with ADHD being prescribed speech therapy. Since that is not typical for a student with ADHD, Diags and ARD facilitators would need to support it in the documentation. Additionally, follow-up is critical. It is necessary that what was said in the ARD is being carried out. You never want to under-deliver or over-deliver services. Services should be delivered exactly as they are prescribed and laid out in the IUP. No more, no less. Should providers inform you at a later date that a student might not be getting the necessary services due to it not being documented, the IEP can be amended. A crucial part of the IEP is the PLAF, or Present Levels of Academic Achievement and Functional Performance. It identifies strengths, needs, and how the disability affects learning in the general education setting. This information forms the foundation for setting meaningful, measurable IEP goals. Without an accurate PLAF, the IEP may not address the student's true needs. It ensures the IEP is personalized and progress can be tracked effectively. The PLAF itself should contain the student's academic achievement, functional performance, student needs, effect on progress in general education, impact of disability, baseline information, and a connection to the goals and objectives. Since the PLAF serves as the foundation of the IEP, its importance to the SHARS program cannot be overstated. Now, let's discuss some special considerations that educational diagnosticians and ARD facilitators should make towards some of the specific SHARS service areas. Starting with both counseling and psychological services, the ARD documentation should include the need for the service tied to the student's disability or condition, goals and objectives, frequency and duration, type of therapy service, like if it is in a group or individual setting, the behavior improvement plan, if necessary. Emergency counseling sessions require that the IEP contains a pre-established BIP or BMP, documenting the potential need in advance. Moving on to nursing. The ARD document should include a description of a skilled nursing service recommended by a professional. Skilled nursing tasks as defined by the Texas Board of Nursing include medication administration, inhalation therapy, ventilator monitoring, catheterization, tube feeding, and suctioning. The ARD documentation must justify nursing as a SHARS service for a student. Medication administration is billed differently from other nursing services since it is billed on a per-visit basis instead of entering start and stop times. For IEP documentation, make sure to document that the medication will be provided by the parent. This will ensure that the school district will not have a responsibility to supply the student's medication. Additionally, you would not want to list the name, dosage, or frequency of the medication in the IEP. In this case, being that specific in the IEP can cause issues later, because should any of those areas change, then the IEP would have to be amended. So in this case, being non-specific is the more sound decision. All nursing services are only billable if noted in the IEP and are a result of the student's medical condition. The ARD minutes should include recommendations derived from the RN, APN, or physician's evaluation of the student's nursing services needs. The specific nursing services need to be included in the IEP, but there is no prescribed wording. It is also recommended to use the phrase "when necessary" in the IEP to grant more flexibility in services as circumstances may require. Both occupational and physical therapy contain distinct elements relevant to diagnosticians and ARD facilitators in regard to the SHARS program. OT and PT require prescription to be on file in order to bill for services. The prescription must be signed by a physician and should be renewed every 3 years, unless it expires before then, if the time of treatment changes, or if your district requires it more frequently. The name and NPI of the referring licensed physician must be listed on the claim kept in the medical record. Most prescriptions have the NPI number of the physician or referring provider on them. If missing from the prescription, the NPI can be looked up at npiregistry.cms.hhs.gov. The ARD documentation for OT and PT must include services that are tied to the student's disability or condition, goals and objectives, frequency and duration, and the type of therapy service where you must specify if it is a group or individual setting. Speech. A referral must be on file in order to bill for SHARS. This can be signed by either a physician or, more likely, a SLP. The referral should be renewed every 3 years unless it expires before then, if the time or treatment changes, or if your district requires it more frequently. The name and NPI of the referring licensed physician or SLP must be listed on the claim and kept in the medical record. Speech therapists whose evaluations serve as the referral must be enrolled with Texas Medicaid Healthcare Partnership or TMHP as either an individual provider or ORP provider. If an SLP does not provide speech therapy services outside of the school setting, they must enroll as an ordering, referring, and prescribing or ORP provider. Our documentation in regard to speech services must include services that are tied to the student's disability or condition, goals and objectives, frequency and duration, and the type of therapy service where you must specify if it is in a group or individual setting. Therapy sessions involving any combination of OT, PT, or speech that are prescribed in a student's IEP are eligible to be reimbursed as a co-treatment session. Multidisciplinary team evaluations are also allowed with any combination of OT, PT, speech, or psychology, even with overlapping time periods. Now, let's examine the details that are especially important for diagnosticians and ARD facilitators when considering personal care needs. Personal care services are support services provided to students who meet the definition of a medical necessity and require assistance with activities of daily living, or ADLs, instrumental activities of daily living, or IADLs, and health-related functions because of a physical, cognitive, or behavioral limitation related to a student's disability or chronic health condition. The approved ADL are bathing, dressing, eating, locomotion or mobility, personal hygiene, positioning, toileting, and transferring. The approved IADL are escort, meal preparation, medication assistance, money management, and telephone use or other communication. Personal care may be provided through hands-on assistance or cueing the student so that they perform the task by him or herself, total or partial physical assistance, redirection, monitoring, and observation related to the task, i.e. the ADLs or IADLs. Academic support does not meet the qualifications for a SHARS billable service. Citing previous IEPs as the qualifying factor does not meet the qualifications for a SHARS service. PCS may include observation, monitoring, and redirection intervention for behavior that interferes with completion of an ADL or IADL, such as withdrawal or unusual and repetitive habits, behavior that is socially offensive, behavior that will or has the potential to cause injury to the student and or others, behavior that will or has the potential to cause damage to property. Now let's go over some of the rules for documenting personal care. PCS is delivered on a one-on-one basis to one student at a time. These can occur at various times of the day. PCS providers can perform PCS for more than one student over the span of the day if each student's needs and IEP do not overlap with another student's needs and IEP. So essentially, the time the provider is assisting one student must not overlap with the time assisting with another student. However, providers may assist students sequentially. Only the time spent on authorized PCS tasks for each student is eligible for reimbursement. Remember, all-day billing is no longer allowed. When it comes to what is required to be in the IEP for personal care, the IEP must have a diagnosis or diagnoses resulting in the need for PCS, as well as any history of chronic conditions. Documentation of medical necessity is required for PCS. Examples of PCS, when or where the PCS is needed, and reasons for PCS must also be included. PCS may be billed for vocational training or on a job site during school hours, provided it is documented in the IEP. Additionally, PCS can be billed outside of the school day. For example, meeting a student at the bus stop or for after-school activities. For any of these situations, the medical necessity must be documented in the IEP. The IEP documentation justifying the medical necessity of PCS needs to answer the following questions or provide the requested documentation. Examples of PCS: when and where are the personal care services needed? Reasons for PCS, such as medical necessity, etc., and why can't the student perform the age-appropriate task? Additionally, personal care services do not include the following: ADLs or IADLs that a typically developing child of the same chronological age could not safely and independently perform without adult supervision. Services that provide direct intervention when the student has the physical, behavioral, and cognitive abilities to perform the ADL or IADL without adult supervision. Services used for or intended to provide respite care, child care, or restraint of a student. Standby supervision related to safety. Teaching a life skills or vocational curriculum. Orientation and mobility or sign language interpretive services. Toilet training. Supervision, monitoring, cueing, redirection, or other form of assistance that is unrelated to the listed ADLs or IADLs. Personal care services may also be delivered on the bus for students who may require additional assistance. The student's IEP must include the need for the service on the bus. This is commonly entered on the transportation supplement page. The need for PCS on the bus must also tie to the PCS supplement page in the IEP and meet the documentation requirements for personal care services. A student who receives PCS in the classroom is not enough to justify them receiving it on the bus. The provider will circle one or both of the ADL, IADL activities on the bus log, escort or transferring. The documentation needs to include examples of PCS, when and where the services are needed, the reason for PCS such as medical necessity, notation of type of PCS service, billed on a one-way trip basis with the IEP including frequency of daily service like once daily or twice daily, and the services are provided on an individual basis only. Last, let's review the final remaining SHAR service, Specialized Transportation. For specialized transportation services, school districts may receive reimbursement on students who are Medicaid eligible and whose IEP includes transportation on a specially adapted vehicle, provided they receive a related SHAR service on that same day. The IEP must include the type of adaptation that is required on the vehicle and why the student needs that adaptation. A specially adapted vehicle is one that has been physically modified. Modifications can include the addition of a wheelchair lift, addition of harness or protective restraint devices, or an addition of child protective seating. Anytime a district's entire bus fleet has a specific adaptation that is not limited to only specialized vehicles, the modification is no longer applicable. This is primarily seen with adaptations like seatbelts. Specialized transportation allows for reimbursement on a one-way trip basis, and up to 4 one-way trips can be recorded daily. These trips can be to and from places such as the student's home to school, school to home, school to another campus, or from the student's home to a contractor. As stated before, in order for these trips to be reimbursed to the school district, another SHAR service must be provided and documented for that same day. The IEP documentation must support the medical necessity as to why the student requires the specialized transportation adaptation. Thank you for watching this training. We appreciate your assistance in your school district's continued success in the SHARS program.